There are approximately 206 bones and 300 skeletal muscles in the human body. Sometimes things can go terribly wrong. Where do you go to get help? Rick's Body Shop.
Hi, and welcome to another episode of Rick's Body Shop, a show about the repair and maintenance of the human body. I'm your host, Dr. Rick, or as some people refer to me as, the Muscle Mechanic. On today's show, we have a 30-year-old female elite ballerina named Nikki with an injured lower back and pelvis. Nikki was dropped by her dance partner while performing an advanced ballet lift in rehearsal about 6 weeks ago. She landed directly on her butt, which sent shockwaves up through her pelvis and lower back. Now she literally has a pain in the butt. She can't walk, sit, or sleep comfortably and has significant pain on a daily basis. Dancers are like pro athletes. Their bodies are their lives. It's how they fulfill their dreams, their goals. It's how they get paid. It's how they survive. Now she can't even stretch her leg out like an average person, let alone like a ballerina that's used to flinging her leg over her head 100 times in her performance. Dancing has been a dream of Nikki's ever since she was a little girl. She's been doing it for over 20 years. This potentially career-ending injury could threaten all that. So stay tuned, because when we return, you're gonna meet Nikki. I'm gonna examine her and treat her and see if I can fix her up before our next show. We'll be right back. Nikki, how are you? What's going on? What happened to you?
6 weeks ago, I was rehearsing for the Nutcracker, and I was doing my Sugar Plum Pas de Deux variation with my partner, and he dropped me from, I don't know, I was probably about over 6 feet above his head, right on my hip, completely down, and the pain shot up into my back, and I have not been able to do much, really rehearse or practice since then. I went to the doctor and basically, rest. I can't dance on it. That's a problem for me because I need to rehearse. I had to get in to see you. You've helped me before, and I just believe that you can help me again.
Oh, no, absolutely. That's
Yes.
a horrible injury. We've treated actually a lot of people like that before, so I should be able to figure out what's going on with you and get you back, but I know you're in a lot of pain. I read your reports and your history and your x-ray, and everything looks good on that end, so we're going to start examining you, and we'll take a look, and I'm going to find those tender spots again. It's going to hurt a little bit.
I know.
So just bear with me,
Okay.
and we'll fix you up, I promise. You landed more on the right hip than the left?
Yes.
And you probably jacked it right up into your spine. That whole side,
Yeah,
right?
it's hard to it's hard to stand on it.
Yeah. Bring your left knee up towards your chest a little bit. That drops down nicely. Now let me poke on the right side. Hurts in there. Ooh,
it's really tough.
we got a live one. Now I am ready for anything that you give me. Bring your right knee up towards your chest.
All right.
Bend it up. Oh, that's not moving anywhere. It doesn't drop at all.
Yeah, I know.
All right, and come back down.
Stuck.
All right, is it safe now to take off this?
Yeah.
I'll take you to all the extremes of motion that dancers are able to move through. That's real tender in there, right? Yeah, we're gonna try to go easy here and just use technique to actually kind of quiet the muscles down. We'll work all these different areas.
Yeah, right in there too.
Tight is means very different things to you and I.
Yeah.
Tight to me means, I can't get out of the car seat. And to you, it's, I can't get it up next to my ear.
Right. I've always viewed dancers as like pro athletes.
Push a little bit deeper. Oh, we got you there, right?
Yeah.
It's a nasty little knot in there. I wind up breaking my thumbs off in your hamstring here, so I think this is going to require some tools.
What kind of tools?
You'll see. I promise, it's a
All right.
legitimate treatment. Well, don't let this scare you at all, but we're going to use some of these nice tools on your leg. We're going to use the special contours to actually get into that muscle, right, and help break up the adhesions in there. I promise you, this is when I get to play mechanic.
Okay.
And I get to use tools and all kinds of equipment and stuff.
Is that what they use in the Middle Ages?
Yeah, it's not right. It's not a far stretch from it.
Okay, all
So
right.
they're making a comeback.
Okay.
They're making a comeback. All right. The stainless steel actually helps us feel what's going on in the muscle there. So we can come from all different angles though and really work it out. Short-term pain for long-term gain, right?
Yeah. All right, now it's my turn, Dr. Rick. You're
That's
shaking?
killer.
Yeah,
That's as high as I can go. It's gonna rip.
I don't think so.
Ow. Yeah. Nikki just did phenomenal with that treatment. I'm so happy for her right now. She had a nasty injury to her sacroiliac joint and her lumbar spine, where all those sensitive nerves, ligaments, and discs are. But as her therapist, I couldn't be happier. Now she's already getting her leg up over her head, feeling better. And I think within 2 to 3 sessions, she may be out on that dance floor dancing pain-free and just doing what she does best. After 25 years of being in practice and seeing and treating a lot of people like Nikki who will probably do really well, there's unfortunately a lot of patients that, due to the nature and severity of their injury, will not make a full recovery. These people may be in prolonged pain and disability for years to come, and that's extremely frustrating for me personally and professionally. I mean, our goal is to always get people back to a pre-injury status, but in reality, that doesn't always happen. So our job now is to help these people deal with their injury and their ailments as best they can, and just improve the quality of their lives to their potential now. Join us for another episode of Rick's Body Shop, where we have a motorcyclist who has multiple injuries to his arms and legs from an injury about 2 months ago. He's going to be a tough one to rehab. You don't want to miss this.